Every day, limited English proficient and deaf patients arrive at hospital emergency rooms and clinics needing a qualified healthcare interpreter. With more than 20 million people speaking dozens of languages other than English, U.S. healthcare providers have sought real solutions to this challenge.
Right now, many hospitals are unable to provide qualified healthcare interpretation to their patients easily. They often rely on family members, on bilingual staff in the hospital who may not be really trained in healthcare interpretation. The dangers of providing interpretation in this way are fairly significant.
New technology advances now enable physicians and hospital frontline staff to access trained hospital-based interpreters within seconds over high-quality, secure video connections.
The treadmill will speed up as we get along the test, and you'll have to walk faster.
The call will be routed to an interpreter first within their own hospital if they're available in that language. If they're not available, it will be instantly routed to a network of hospitals throughout the country who have interpreters in a wide variety of different languages. If none of them are available, it will be routed to a commercial video or telephone interpretation company. Nurses and physicians do not need to think about where will the call go, how will I get them, if during these hours it's one thing, during these hours it's another. Every time they push the button for that language, they will get an interpreter in under 1 minute.
Interpreter productivity is tripled in this model because interpreters can serve multiple sites without leaving their workstations. No time is wasted driving to a clinic, walking across a hospital campus, or waiting for the doctor to enter the exam room.
They can make use of the economies of scale of sharing interpretation with hospitals throughout the country who have some of the languages they may not have on staff. Once you realize you could get interpretation everywhere instantly, you realize you really can't live without that.
Video is the option that best approximates the experience of in-person interpreting. Seeing the patient and provider, the interpreter makes use of visual cues, like facial expressions and gestures, in addition to the spoken word. This improves communication and helps the patient feel at ease.
The video translation is so important because you see another face. You're in a strange country with strange doctors. You don't know the system, don't know the language. But, again, seeing a face with all those kind gestures, I think bring a lot of comfort. And to me, it's a blessing.
You're doing well for now.
Being able to provide medical care in an expedient and efficient manner in the language that our patients speak is not only a necessity for good patient care, but also shows a great deal of respect to the diversity of our patients.
Of course, video interpreting is essential to accessing American Sign Language interpreters for the deaf, especially when in-person ASL interpreters are not readily available. Patients and providers are delighted to know they can see a qualified interpreter in less than a minute. Risk managers appreciate the security of the dedicated network and the reduced likelihood of medical errors. Hospital administrators quickly grasp that the intelligent call center model, routing requests to their own interpreters, their colleague hospitals' interpreters, and commercial interpreter services, is the most efficient and cost-effective path to outstanding service for the limited English proficient or deaf patient. Paras and Associates has brought this technology to healthcare providers throughout the United States, allowing them to share needed interpreter resources by using a hosted service called ALVIN, the All Languages Video Interpreter Network.
And now, telemedicine solutions that utilize the same infrastructure as their interpretation system can be offered at a very low cost. We have government systems, such as the court systems, and other social service sectors beginning to explore the use of these technologies. This solution could be really effective in tourism, in both hotels and airports. Really, the technologies that we've helped to design for language access are going to reduce the barriers of communication throughout the world.